Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Crinan-Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
This summer, we are going to be in upstate New York in Rhinebeck. The Omega Institute has invited Dr. Marshall, Dr. Hrkal, and Melinda to present and talk about concussion. They're going to go over the new program for the Concussion Fix that they are currently recording to launch later this summer. So we would absolutely love to be able to see some people there. And before we go to questions, I want to give a shout out to who decreased her symptoms by 84 points in 7 months, which is absolutely amazing. And went from starting the program at 50 out of 132. In only 5 weeks was down to 19. So huge drop in symptoms in only 5 weeks. So want to give a shout out to those 2 members. So we can start with.
Good morning. I have a question. So I've been doing quite well, but I had a recent reoccurrence of symptoms, and I know that Dr. Marshall talked about the concussion cliff. So the symptoms are the headache and the dizziness. I am back to work almost full time, so I wonder if that's a factor. So I guess the question is, what happens if you're like doing really well, almost forget that it's all done, and then you're back to the symptoms. I did find, I know Melinda's not there, like it was difficult mentally too, but I was just curious, how do you kind of dig out of it? Thank you.
Yeah.
Oh, and then on top of it, I've been also following the diet. So I've been actually following, so February, March, April, May. So this is my month 4 with the like the gluten-free, dairy-free, reduced sugar, or like no processed foods. So when I started it, I was doing really well, and now I'm still doing it, but it doesn't seem to be helping anymore. So that's kind of sorry. Thank you.
Yeah, maybe I'll comment on the diet component. So usually what we find is that the dietary benefits are going to be found in the first 4 to 6 weeks, which is kind of why we set the timeline at that point. Some people will get the benefits, but then the benefits kind of like plateau, I guess is the best way of saying it. Like I said before, a third of people have very, very positive, major resolution of symptoms types of benefits. A third of people kind of have, I feel overall better, generally more clear-headed, less bloating, less maybe inflammation. So I would put that kind of in that moderate responder category. And then there's a third category where diet isn't the big deal for them. It's another obstacle. So maybe if you are not in that really positive responding category, you still might be getting benefits in more subtle ways. One final thing I'll mention is that really sometimes the benefits of the diet are not fully felt until you totally go off it, or at least start to reintroduce some of the things. And what I mean by that, I just had a patient yesterday where we found their food sensitivities, we avoided those food sensitivities, and then the person had some cream. She happened to be very sensitive to dairy, and she had tremendous digestive upset. She hadn't had dairy in over 6 weeks. And that sometimes happens on the reintroduction. So if you haven't got to the point where you've started to reintroduce some of the foods you've avoided, before we kind of say, I don't know if the diet's done anything for me, it might be actually playing a kind of a stabilization role in behind the scenes. And you won't really know until you kind of go off it a little bit.
Okay,
Yeah.
so do you recommend getting off it and see how it is at the same time, or
Well,
yeah?
I mean, I think getting off it is it sounds like a pretty aggressive term. What I would kind of say is I would suggest maybe you reintroduce some of the foods that you've been avoiding, particularly gluten and sugar, maybe one at a time. Like say, okay, for this next week, I'm going to try a couple pieces of gluten, probably in the most simplistic state. What I mean by that is, maybe something like a sourdough bread, something that generally is going to be better tolerated anyways. Another good example would be something like, just a pasta where the ingredient is just wheat. The problem is that wheat is made into a lot of different foods that we enjoy, like for example, a croissant or a pizza where it has other foods included in it. A croissant is painted with egg, for example. That's why it gives it a nice brown color. Obviously, has dairy, has gluten as well. So try to keep it as simple as possible. Reintroduce that for 5 to 7 days, and then see how you feel. See if you notice any reoccurrence or aggravation of symptoms, and then go ahead and do the same thing with other foods you're avoiding, like for example, sugars. Sugar, I find, is a major amplifier. So a lot of people may not be sensitive to it in the same way they're sensitive to gluten, where it's an immune reaction, but it just makes a lot of other issues, microbiome issues, imbalances worse. So something to think about before we kind of fully judge the benefits or the lack of benefits on a diet.
Yeah, make sure you introduce it slow, because if you do too many things at once, you're not going to be able to pinpoint which thing it is. Just like a story to highlight this is I did an elimination type diet when I was having all these weird digestive and gut issues and I wasn't sure what it was. So I did a full elimination diet, and then you slowly introduce things one at a time, right? So the first thing I introduced was wheat and bread, and I was fine. And then the next thing I introduced, I think, was dairy, and I was fine. And then I brought back eggs, and I got a headache. I was having, all sorts of digestive upset and everything. But if I were to do something where I brought a bunch of those in at once, then you don't know what's going on. So I was able to introduce every single food, but I found out that my sensitivity is egg. So now I avoid egg and egg only. Right. So if you do it slow and controlled, you'll be able to find maybe one or two things that flare you up, and the rest are fine. And then your diet is less restrictive and it's much easier to follow. So I would just say be slow in your reintroduction. Another point I would make, like what Dr. Hrkal said, is oftentimes we don't know that we've had a lot of benefit until we actually start bringing things back, and then your symptoms come back, tenfold. And just a perfect example of this is I'm currently treating a patient for some neck issues. And so the first time I see her, her symptom score is like a 46. I treated her once. The next time I see her, I said, well, how are you feeling? She goes, oh, I'm pretty much the same. And then we do her symptom score, and she's at a 20. She had a 50% reduction in her symptoms, but she feels that she's the same, no better. But when you actually start looking at it, you realize that, oh, I actually am getting much better. And I think now she's at like a 15 or something like that, but she'll still say like, oh, I'm pretty much the same. So I think there's probably a lot of benefit that you've had that you're not necessarily realizing because it happens kind of slowly. So keep that in mind. Now, in terms of work and return to work, that could definitely be playing a factor because that's a stressor, right? So any stressor is going to
push you towards the edge of that cliff, and returning to work could be that stressor that did that. What do you do for work? Can we ask that question? Is it a desk job?
So it's a desk job, and I am now on accommodation. I'm working full time from home. I did get a curved screen and like adjusted a proper chair and everything, but I look at the screen. There's like spreadsheets. I have meetings and discussions, phone calls, that kind of stuff. Yeah.
Right. So there's a few things to consider there. Like, one, you're going to be sitting more than normal, and two, you're going to be doing more visual activity than you're used to, right? So as you ramp that up, if there's some neck dysfunction, you're sitting in a posture all day, even if you have a perfect ergonomic setup, you're still going to be posturally strained while you sit all day. Like, humans were not meant to sit all day. We were meant to be out and about, hunting, gathering, caring for children, and that type of thing, on the move. And now our life is sitting in front of a computer. Like, that's just not what we were meant to do. So potentially there's some, visual issues that are creeping up, or maybe there's some neck dysfunction that's happening. And usually those two things are combined. So if you do have some neck issues, if there's increased stress or cognitive load, people hold tension in their necks. And so headaches, dizziness are often neck related. And also that starts to affect your visual function. And so if you're looking at the screens and your eyes are tracking a lot and you have neck dysfunction, that's going to start perpetuating headaches and some sensation of dizziness. So how do you get out of that? I would say you just need to incorporate try some neck treatment and see if that helps to alleviate those symptoms. Try taking frequent breaks and getting up and walking away, and going for a walk and kind of stretching out your chest and breaking that cycle of just sitting all day in front of a computer, right? So try to take a break every 20 minutes and get up and stretch and move and that type of thing, and that might just break the cycle and help you to just reduce those headaches, right? So remember that persistent concussion symptoms are not due to anything kind of brain related, right? They're due to other factors. And so you have to think about what those factors are while you're sitting at a desk all day. To me, the most common ones would be either visual issues or neck issues. So I would say incorporate some good manual therapy, maybe go get a massage, see if that helps to alleviate or allows you to tolerate it for longer.
I have been doing breaks because I have an OT, so I do breaks. I go for walks. I have, I get massage and all that stuff. But it's just maybe it was too much at one time, and it's discouraging. So
Possibly.
Yeah, I don't know, but I guess it's what you're saying is there could be other factors, or it's just the too much factor that kind of made it worse, right?
Yeah, and it could just be the initial. Like, how long has this been going on for? Did you go right from 0 to full time, or what was the progress?
Pretty much in a month, and I had to now back down because it's been so. I'm now back to 5 hours, and I'm building it back up.
Yeah, so do that slow, right? That's usually the problem, is people try to rush this part. Like, okay, I have to be back in a month, and that's just not enough time. Like, generally we say, like, start with a Monday, Wednesday, Friday, like 2 hours per day on each of those days. So you always get a rest day on Tuesday, Thursday, and the weekend. And then only increase the hours on the Monday, Wednesday, Friday, so that you continue to get a break. So you increase by, let's say, 1 hour every couple weeks. So now you're doing 3 hours. Then you're doing 4 hours on each Monday, Wednesday, Friday. Then you're doing 5 hours. And eventually you get up to doing 8 hours on Monday, Wednesday, Friday, but you always get Tuesday and Thursday to kind of reset. And then once you're able to tolerate full time on Monday, Wednesday, Friday, then you start adding an hour or two on the Tuesday, Thursday. And then you gradually build those up so that this progression allows you to ease into it. Going right from doing nothing to now working full time after a month is just not enough time. So you have to kind of build that up. So that would probably be something that's impacting it for sure. You may just need different neck treatment too. Maybe the massage isn't the right treatment for you. Maybe you need some, more aggressive ART or, whatever. So it's just trying to figure out what's going to help you alleviate those headaches. Most headaches are related to either inflammation or autonomic. Are you able to exercise?
Yes. Oh yeah. No problem at all.
Yeah. So then it's probably not autonomic. So it
No,
would
it's not.
be, to me, it's inflammation or neck. And because you're being diligent on the diet, to me, it points more to neck.
Okay.
So you
Sounds good.
you may just not be getting the right type of neck treatment to alleviate the headaches that you have.
Okay, but you've seen this before where people are back to normal
Oh yeah,
and when they start
all the
working.
time. Yeah.
every second patient. This
It's
is
like the
like this is
most
very
common
common,
thing. Yeah.
right? And it seems discouraging at the time, but like the fact is you're getting back to work, so you're close, you're there. You just need to kind of get over that last little bit, right? It's the last 10% that's, even when you think about weight loss, those last 10 pounds are the hardest, it's the same kind of thing. It's getting to a point, it's maybe discouraging, but just reaffirm that you're close, and
Okay.
it'll be no time, and you'll be like, okay, I'm fully there, which is
And I guess the fact that I was symptom free tells
Yeah.
me that like I got there. It's just
Yeah.
Totally.
the
Yeah.
overdoing it kind of thing. Okay, great.
That's
Thank
it.
you
And
so much, guys.
don't be too worried about, quote, overdoing it. Sometimes you're just building up your tolerance, right? Like it's the same thing I always say with like exercise, like, essentially like going back to work would be like running a marathon, right? If you had a month to prepare to run a marathon and you hadn't been running, you're not going to do well, right? You're going to destroy your body in that marathon. So what do? Well, you start by running a couple kilometers a day, and you make the goal to be back to running a marathon in a year, not in a month. And then you gradually build up your tolerance as you go. So it's probably just that you tried to run a marathon in a month, and it's just too much, and it's creating some problems. So if you just slow that down, if you can build that process more gradually, you're just going to build your tolerance for it in a more controlled way, right? You're just getting yourself in shape.
Right. Yeah, and on top of it, I have all the family responsibilities, so I guess that's part of it. So, okay, great. Well, thank you so much. I
You're
appreciate it.
welcome.
Thank you.
You're welcome. You're close. You're close. Don't get too discouraged. You're
Yeah.
close.
Okay.
I agree.
Thanks.
You're welcome.
I think the last thing I'll just end off with is that sometimes it's not that something's wrong with you. That like we obviously are always looking for like the root cause. Like, what did I do wrong? It like the hardest thing that most people do is their jobs. And as Dr. Marshall said, it's a compound activity. You're using your eyes, you're using your neck. Now you're adding in stressors, you're adding in deadlines. There's a huge connection between all the things that you're doing at work and aggravating any sort of residual symptoms. And it is the marathon analogy, and the training for it is, I think, really perfect. So I think you have some good things to think about, and really seeing if you can stretch that out a bit more.
Great. Thank you.
Okay.
Next question is,
Yeah, thank you. I will read my question because that's easier. I'm reaching out because I seem to be stuck in my recovery. I struggled with a neck-related headache to what I would call a very extreme degree. It seems to increase during my sleep and is very bad when I get up in the morning. I'm almost always very fatigued, and rest doesn't help at all. I'm often dizzy, but not always. The neck pain and the headache and the fatigue, and it feels as if it's connected. I've been working in this program for 9 months. I've followed the diet. It hasn't made a big difference to me. I'm doing the yoga and the meditation, and I have spent a lot of time in Melinda's section, which has helped me a lot, especially with my mood and my hopes. I have a good sleep hygiene. I do not avoid activities that trigger symptoms, and I do not worry too much anymore. I go to the gym almost every morning after breakfast, and then I do 4 heavy strength exercises. I don't do cardio on the cross trainer anymore because it makes my symptoms worse. The same with neck rehab. I don't do that anymore because I think it makes my neck pain worse. I've seen both PTs and osteopaths, and my feeling is they seem to give up on me because I don't get better. And now I don't have so much money, so I can't continue. So I do some massage on myself. But I engage in activities with other people. However, I don't get much out of it because I have a feeling that my symptoms create sort of a wall between me and other people. I'm always thinking about when can I lie down and when can I have a rest. So that's my issues.
Okay.
No, it's a big question, but
Yeah, there's a lot of info there.
Yeah.
Can we ask a couple more questions here? So just to be clear, you said you have a headache and fatigue and dizziness. Is that right? Are those your three main symptoms?
That's right.
Okay. The headache you said is worse in the morning, is it? But it's also must be worse after the neck rehab.
Yes, it's
Okay.
every morning. It's very bad when I wake up.
Okay. All right. Is this every single morning?
Yes, it is.
Okay. Um, how have you had your sleep quality assessed before?
Well, it's become better during this course. It's become better. Now I only wake up once during the night, so I sleep 7.5 hours or so every night.
Mm-hmm. Okay. Where's your headache?
My headache is in the it's in the neck, and then it spreads out into the forehead and everywhere.
So it
I
starts in the back and then kind of like
Yeah,
spreads toward
yeah,
here.
exactly.
Is it both sides equally?
Both sides. Sometimes it's almost like a migraine. I used to have migraines when I was younger, and sometimes it develops into a migraine, but mostly it's just headaches.
Okay. Well, I'm sure Cam will have a couple things to say here. First of all, uh, when a person wakes up with a worse headache, there's a couple things that come to mind right away. Number one is the posture that you are in while you're sleeping. So, for example, something like a pillow, or are you a back sleeper? Are you a side sleeper? Have you changed or changed your mattress and or pillows to see if you sleep a little bit better with a different kind of ergonomic rest at night?
Yeah, I've just bought a new pillow, but it doesn't seem to help me. I used to sleep on my stomach, but that's also one thing that I've changed. A couple of 2 months ago, I changed it. I've sort of made it impossible for myself to turn around, so I can't sleep on my stomach. So now I sleep on the side.
Okay.
But
And changing these things makes no difference to your symptoms.
no, not yet.
Okay. Uh, the fatigue piece, has you talked to your primary care provider to rule out any sort of like metabolic reasons for fatigue? For example, the most common one would be iron deficiency. Basic blood work should be able to tell us that.
Yeah, but I did get a test, an analysis of my blood, which shows that I don't have any what you call it,
Deficiencies, yeah.
deficiencies. Yes,
Okay. And so that's all normal.
yes,
So like, the typical things are iron. If there's fatigue, you're thinking iron, you're thinking thyroid. Those are the two main ones. B12. Have those three things been looked at?
that was all right. Everything was all right. The doctor told me.
Okay. So at this point, the other thing to consider is that even though you're sleeping and you feel like it's getting better, there could be something called sleep apnea, which is you stop breathing or there's some obstructed breathing. Has anyone ever told you that you snore overnight or that you stop breathing?
No, no, I don't snore. I have a very, I don't know, I have quite a, the only thing I know that could be interesting in this case is I have a very low blood pressure and I have a very low pulse rate. I
Or
don't know if
like
that
50,
means
like
anything.
sub 60?
Yes, sub 60. When I sleep, it's about 42 or something. I don't
Okay.
know if that's
Okay. Well,
very low.
I 100% think there's a neck issue. The reason being that the neck rehab makes it worse. I think that's like a big thing there. Also, the dizziness could absolutely play a role. Obviously, the headache. So there's something about the night and the neck causing that. Obviously, it sounds like you've ruled out some of the other causes of fatigue. If you're not getting a restful sleep and you're in pain, then you're going to be tired. There could be a couple things going on. Like we're just asking some basic questions to try to help you, point you in the right direction. Obviously, we're not your doctor. We're not putting our hands on you.
Oh, I know.
Yeah, Cam, do you have any other thoughts based on what was just said?
Yeah, a few things. One is, have you checked yourself with like the POTS self-assessment kind of screen where you've looked at your heart rate and blood pressure while you're lying down and then compared that to when you're standing up?
No, I actually haven't because I didn't really think it was had something. I didn't relate to the symptoms because I didn't have this raised heart rate when I got up, so I skipped that part, I must admit.
But there's also a blood pressure component to that, right? So dysautonomia can have a couple forms. The most common one is, for concussion patients anyway, is POTS, where you have the increase in heart rate. But there's also orthostatic hypotension, where you have the drop in blood pressure.
Yeah.
And if you're already having, potentially like low blood pressure issues, that could be contributing to that. You mentioned that cardio makes your symptoms worse, so you're not doing it, instead opting for strength training. But you're supposed to kind of not do strength training until you've been able to master the cardio. So
Yeah, I know.
if the cardio is increasing your symptoms, usually that means you're going above your threshold. And if you find that even at a low heart rate, you're still getting symptomatic, then it's trying to isolate the variables. So one possibility would be like, okay, let's say you're walking and you're having increased symptoms. Well, it could be the heart rate issue, meaning you're going above your threshold. It could be visual motion, or it could be, the fact that your neck is bouncing each time. So then what you do is you say, okay, well, I'm going to try a different form of exercise where I don't have the visual motion and I don't have the bouncing. Maybe I'm going to try it on an exercise bike. Oh, I still get symptomatic with that. That kind of points you more towards it being an autonomic issue. And if you're still getting symptomatic at a really low heart rate, then I would see, like, is there a POTS situation here? Right? Is there some sort of dysautonomia where I have to change up my exercise and do things that are more kind of recumbent and supine because it's the being upright that causes the symptoms, right? The fact that you're out with people and you're like, oh, when can I lie down? To me, I'm thinking like maybe there's a dysautonomia component here that is making you feel like you just need to go and rest and lie down. So that's one possibility. And so um, I would dig into that, right? Because the cardio is very important to do. You shouldn't stop because it increases your symptoms. You just have to find out, what is my threshold? How can I work below that and then gradually build up my tolerance? Because resting is not going to fix your autonomic system. You have to do the exercise work, and it has to be done in the right way. Because if you're doing strength training, for example, and you have a neck issue, that's potentially going to flare up that. So that's why we always want to make sure we can master the cardio first before we start adding in the strength and everything, because now we can isolate variables. Because it seems like right now you've done a bunch of different things and we're really confused as to what's going on because we haven't isolated the variables properly. So I would go back to the exercise module and try to kind of follow that more stringently to figure that piece out. In terms of the neck, yes, I definitely think there's a neck component here because the neck exercises are kind of flaring you up, which means that manual therapy is the way to go. And generally, self-massage is not going to be helpful. It's just very difficult. You need to find a practitioner that's really good to be able to treat that. You've tried PT, you've tried osteopathy, but it might just be the wrong practitioner, right? Like if you've tried one osteopath, you've tried one osteopath, right? If you've tried one chiro, you've tried one chiro. There's many different people out there, and different people have different hands, different ways of doing things, different ways of looking at things, different skill sets. So it's very practitioner dependent. So you may just need to kind of shop around until you find somebody that's actually able to get to the underlying issue, because I definitely think there's a neck component here. And again, different pillows, different whatever. And it's not necessarily like, people always think like, oh, sleeping on my stomach is bad, so I have to try and do things to completely restrict that and just lie on my back the whole night. Staying in one position, right? It's not sleeping on your stomach that's the problem. It's actually staying in one position for a sustained period of time that's the problem. Your body needs movement, right? And so by just saying, I'm going to restrict myself and only allow myself to sleep on my back, guess what happens to your neck? It sits stationary for the whole night. And that's going to cause inflammation in the joints. It's going to cause muscles to stiffen, right? Like you should be, going from this side, rolling to this side, then on your back for a bit, then on your stomach for a bit. Like you need movement throughout the night. And creating a situation which doesn't allow that to happen actually can make things just get stiffer and stiffer. So I wouldn't necessarily try to restrict yourself. You want to just sleep in a position that's comfortable for you. And generally you're going to change positions throughout the night. And that's normal, that's natural, that's actually good. So, I mean, one thing I'm kind of thinking right now is I would like to take you through like the symptom score. It might take a little bit of time, but it might just help to isolate some things for you.
Yeah,
Would
that would be nice.
you want to do that?
Yes, absolutely.
All right. So I'll share my screen and we'll try to get through this as quickly as possible. All right. So rate your symptoms 0 to 6. Okay. So headache 0 to 6. How would you rate that?
I would rate it 4.
4. Pressure in the head.
3.
Neck pain.
6.
6 out of 6.
Yes, absolutely.
The worst neck pain you could ever imagine.
Yes,
All
absolutely.
right.
Yeah, I
Okay.
think so. Not all the time, but it's 5 to 6.
Okay. Nauseousness.
No.
Dizziness.
3.
Blurred vision.
No.
Balance problems.
Yes. I would say 2.
Sensitivity to light.
4.
Sensitivity to noise.
4.
Feeling slowed down.
No. 1.
Fogginess.
No.
Not feeling right.
No.
Difficulty concentrating.
No.
Difficulty remembering.
No.
Fatigue.
5.
Confusion.
No.
Drowsiness.
What is drowsiness? Like sleepiness?
Yeah.
Yes, I would say 4.
Trouble falling asleep.
2.
More emotional.
No.
Irritable.
No.
Sadness.
No.
Nervous or anxious.
2.
So let's go and look at. So yeah, neck is number 1. Inflammation, gut hormones 2. 3 is autonomic. 4 is visual vestibular. 5 is psych and mental health.
Okay.
So I definitely think there's a neck component here. I also think that like sleep might be a big factor here,
Yeah.
right? And here. So, I mean, my recommendation for you, like Dr. Hrkal mentioned, might be a sleep study, right? To actually like go into a lab and see what your sleep quality is, right? Maybe there's frequent waking that you're not aware of, that may be just making it so that you're not getting a good night's sleep, which that's how you clear inflammation is sleeping. And if you're not getting a good restful sleep, even though you're getting 7 hours or whatever, it doesn't really matter the time. It's what's the quality of that 7 hours. So you might need to get a sleep study. Second, I would go back to the exercise section and I would test my heart rate and blood pressure. You can get a blood pressure cuff on Amazon. They're just automated blood pressure cuffs. I have one right here.
No, I have one actually. I just got one from my boyfriend.
Perfect. Test it. So test it lying down. You lie down for 2 minutes and then you press the button and test it after 2 minutes. And then you stand up for 2 minutes, just stand still. And then after 2 minutes of standing, you test it again and you look at the difference. See if the blood pressure drops or if the heart rate rises. So that's the one thing. Second, third, I guess, I would start looking at trying to isolate the variables on my exercise and try to figure out what my threshold is. So go through that exercise module again and gradually build up your cardio tolerance.
And
And
start with the bike. you said.
Yeah, you could start on the
Yeah.
bike. You could start, it doesn't really matter how you start. It's just figuring out the threshold. And if something flares your symptoms, try a different modality and see if that changes. And then the final thing would be trying to find a different practitioner to treat your neck. Where are you located?
Denmark.
Denmark?
Yeah.
I don't think we have anyone in Denmark, but let me just double check.
I don't think so. I've looked before, Cam.
Yeah.
Yeah.
We're always adding new ones, though. I'll take another peek.
Oh, maybe true. Yeah, true that.
Yeah, we do have one in Denmark.
Really?
Yeah, but it's in the north. It's in a small town. Hinnerup?
Oh, that's quite a long way. But
Yeah. Where are
it's
you? Are you in
good.
Copenhagen or where are you?
Yes.
You're in Copenhagen. So, yeah, you're kind of far away from everything. We have one in kind of Sweden. We have a bunch in Norway. But you may just need to look around, see if you can find a chiropractor, just a different way of looking at things. I don't know. It's just trying to find a different practitioner, right? Go and look up people online, see who specializes in the treatment of headaches. You may just need a little bit of a different approach.
Yes.
Yeah. But those would be my top things.
Okay.
Analyze sleep, test yourself for dysautonomia, exercise, try to build up the cardio to kind of get that working, and then find somebody else to look at neck.
Okay. Thank you. This is recorded, right? So
Yep.
Otherwise I can't remember. Yes.
Yeah.
Thank you.
Yeah.
Thank you very much.
You're welcome.
You're welcome.
Okay, next up.
Hello?
Hello.
Nice. Can you hear me? So I've taken a neurological test quite some time ago, and it showed that my main problem was with the executive function, difficulty remembering things, what was said right before, creativeness, and stuff like that. So one question is perhaps best for Melinda, but I'm going to say it anyways. So doing creative activities, is this important for retaining executive functioning? Like improving your creativeness by trying to be more creative, like using Photoshop, for example, Illustrator, and stuff like that.
I'm not sure I understand the question. Can you?
So basically, like doing creative activities, will this improve your
Yeah, I see what you're saying.
like creativeness?
Yeah, so like anytime for neuroplasticity is specific to the area of the brain that you want to rebuild. So if you want to rebuild the area of your brain where it comes to music or creativeness or art, those are specific areas of
Finding words to explain certain things,
Yeah.
for example.
You're going to have to do more of that. That's right, Tori. Yeah. You're going to have to do more of that.
Okay. Next one is about how important is like having good posture throughout the day for recovery, and is having bad posture really bad for recovery also? Can this be good for social skills and stuff like that?
Are you talking about like neck posture, like head carriage?
Yeah, I have this standing desk thing. Every time I'm looking at the computer and stuff, I'm standing. I'm trying to do like foundation training and stuff. You have to pay for each month or try to do it every single day, like 12 to 15 minutes every day, like posturing stuff. Is this important for recovery? How much of a beneficial effect can this have? Having good posture throughout the day, comparison to if you're not having good posture.
Yeah, I think it matters. Because, and it's mostly just like if you have really bad posture, that just increases the likelihood that you're going to have dysfunction in your neck, right? Like for example, if your shoulders are really rolled forward and you have what's called a kyphotic thoracic spine where it really bends forward, what's going to happen is your head's going to be forward, and so to counteract that, you're going to lift your chin up like this, and that's going to jam up your suboccipitals and all that stuff. So working on getting the shoulders back and down and the chin kind of back so your head's not way out here just allows you to not have to like try and hold that neck position, which is going to just cause tightness and stuff, and that can cause headaches and dizziness and all sorts of other things. Now, I think people get too carried away on posture. right? I think the biggest thing is movement, because it's not necessary, like any sustained posture, even if it's perfect, is not good, right? Even if you have perfect posture and you're just staying there, because you don't have that kind of fluid movement. You need the movement. So standing desk is obviously a great kind of first step to this. I wouldn't get too carried away about always trying to have perfect posture. It's more so just breaking up cycles. So being it like if you're working for a bit, taking that break, stretching out the chest, like pulling the shoulders back and down, tucking your chin back, moving your head, like that type of stuff is way more beneficial than worried about trying to always maintain perfect posture. Okay? But I mean having good posture, sorry?
Movements, taking breaks with the movements,
Taking
basically.
breaks with movement, little micro movements. You're working for a bit, stretch out the chest, bring the shoulders down, tuck the chin, just kind of give a good stretch, and then, you know, stretch the neck, just move around a little bit, and then go back to whatever you're doing. Like that type of little movement break is going to be more beneficial than worrying and focusing on your posture 24/7. But that being said, posture is important if you do have dysfunction where it's like your chest is really tight and it's just pulling everything forward. Okay, working on getting the chest back and just opening that up is going to change fundamentally the biomechanics and help. Um, Again, so I think it's important, but I don't think it's something that needs to be like perfect posture. You know what I mean? Like I don't think it has to be super diligent. If there's dysfunction, then yeah, work on it, but it's not something that I think that if you just changed your posture and had perfect posture all the time that you wouldn't have any symptoms. I don't think it's that kind of black and white.
So this isn't like a quick fix. It takes time to develop your.
Yeah, I mean, if you have a postural fault, right? Like if you have an anterior head carriage or like what's called an upper cross, where your chest is really tight and it pulls everything forward, and you have this anterior head carriage, that's taken years to develop, right?
Yeah.
This hasn't just started overnight, and it's not going to fix overnight, right? It's like you have to do work to kind of undo the years of this that's led to that. So now it's doing work to gradually kind of bring things back. And that, yes, that will help, but it's not going to be something that just changing your posture is going to automatically just get rid of things, right? And it's kind of difficult to do on your own, right? If there's issues, like for example, my brother right now, he has this shoulder issue. And I work out with him at the gym all the time. He's always complaining of this, shoulder issue, whatever. So I sent him to one of my buddies to work on him. And he's been working on him for like 2 months and nothing's really like getting there. He still is like he can't bring his shoulder down. It's like he can't get it down. It's always hiked up like this and he can't figure it out. And then just the last visit, he got into a different area that he's never been in. He started working on the scalenes and stuff and released all this tension that he had on this side of his neck because everyone was looking at shoulder and trying to fix that. But then he released some of the things on his neck and now his shoulder just dropped down because his neck muscles were actually hiking his shoulder. But sometimes it just takes the right practitioner just like, trying this and then trying that and then trying this. And so it may not be something like that you can even correct because like he would sit there and try to force his shoulder down, but no matter how hard he tried to do that, it wasn't letting go because it was stuff up here that was holding it up. So you may need some manual therapy to try and figure out why certain things are the way they are. And you may need somebody to dig in there and kind of release some of the tissue that's holding things. So again, it's not something a lot of times you can just like fix on your own. You can try to do things, but if you're still not getting there, there's probably some tissues that need to get released in order for you to be able to do it properly.
Yeah, and one last thing, you have like different concussion fix places you can go to over the world.
Mm-hmm.
I'm stationed in Norway. Is this like a brain camp type of thing that shows you like if you have something wrong with your vision, vestibular, neck, and stuff like that? That you're like going to Oslo, for example, for a week or something, and they check you. Is that how it goes?
It's not, we don't do like week intensives. But if you click, Nikki just put the link in here, clinics.completeconcussions.com. These are all people, we have a ton of clinics in Norway. So you're lucky there.
Yeah.
I'll just share my screen here. So here's Norway right here, right? So like in Oslo, for example, if that's where you're at.
I'm not in Oslo now.
Where
it's quite a long drive. I'm in somewhere called Overhalla. It's 9 hours away. So it's quite a
are
long
you
drive.
north or?
Upper Trøndelag is the... You can see longer above. more above. You should see Trondheim. Go above that.
Right here?
No, above.
Above?
Grong. There is it. Namsos.
Right here?
Yes, right there.
Okay.
Yeah.
We did have one that was up in here, I think. And so they've at least had training, but they're not with us anymore. But I don't know if they lost their practitioner or what happened. But if you contact Nemus, so
Nemus. Yeah, I've been there before.
yeah, so Nemus has we have clinics, but I know the owners of Nemus.
Yeah.
And if you contact, is it this
also in Trondheim? Because
Hold on, I'm just gonna see. So this guy right here is the owner of Nemus.
Yeah.
So if you contact this clinic, so this one is the Storo, is it? Storo. Okay, I'll put the link in the chat for you.
Okay.
If you contact this clinic, call them, try to talk to him, and ask if they have a clinic in the north that went through complete concussions, and if they have anyone up there that can treat you. So you don't have to go all the way to Oslo. I'll just put this link in here for you. So you can just click right on this link.
Yeah.
And that'll take you, and they'll tell you if there's a clinic that's closer to you that's gone through the training and has somebody that has done complete concussions training. And then what they'll do, they'll put you through a treadmill test. They'll look at visual vestibular. They'll look at your neck. They'll look at all the different components to see.
Also stuff like executive functioning, like neurological test type of thing.
Yeah, not as much, because executive functioning, like cognitive, most of that is related to the other symptoms. Right. So, for example, cognitive function is mostly tied to anxiety and depression and mental health, but it's also tied to inflammation. It's also tied to neck dysfunction. It's also tied to autonomics. So, by treating all the other components, usually cognitive function just recovers. So it's not usually something that needs its own specific thing. Like if you were just to go and try to work on executive function alone, but you still had headaches and autonomic dysfunction, you're not going to get anywhere. So the way that we handle this is, let's fix all the other components first, and cognitive function usually falls into place. If cognitive function doesn't fall into place, now we start looking at, okay, how do we rehab specifically for that issue? But I wouldn't start working on that now if you still have other symptoms present.
Okay.
Fix those other symptoms, and then cognitive function improves, right? It's pretty hard to have good cognitive function if you're dealing with a headache 24/7.
And that's the most important thing, like getting back my creativeness. I want to be as creative as I used to be, using like design and stuff like that. But
yeah, but I think it's getting rid of the other symptoms, but also if your mindset is sitting in a place where you think, I'm not as creative as I once was.
Yeah, that's
then you're gonna see examples of that everywhere.
Yes.
Right. And then that just reaffirms that I'm not as creative as I was. So that's kind of where the mental health comes around, is like mastering that mindset.
Default mode interference and stuff.
Exactly. Because when you're in that default mode interference, you're just getting that kind of almost negative self-talk that prevents you from being creative. Right. In order to be creative, you have to have a calm mind. Like that's the whole thing, right? So working on those other pieces is what is going to restore cognitive function. Because if your mind is going all over the place, you're unable to kind of just be in that calm, focused state. So working on those pieces actually is what improves cognitive function the most.
So that's the main focus. Just focus on the physical, neck,
physical and the mental.
On the mental.
Yeah, the physical and the mental, and then usually cognitive function improves, right? Like once you're, okay, I'm feeling good every day, like your mood elevates, now you can be creative. But if you're not in a good state, trying to be creative it's just not going to work. So I wouldn't get into trying to improve that one area until the other things are improved.
So I should stay away from like doing very like creative activities, trying to force myself.
No, I wouldn't stay away from it. I would continue to do it. But when you're doing it, just try to think of where your mind goes. Like I wish Melinda was here, because she'd be able to kind of articulate this much better than I am, but you can do the work, like still do it and get the repetitions and the practice, but just be aware of where your mind goes. Do you have that negative self-talk? Are things,
Yeah,
do you
now I
have,
have that. Yeah.
right? And so still do it, but just notice when that happens and then say, oh, I'm doing that again. And see if you can come up with some strategies around that to, say, this is more of a Melinda question. I don't want to say anything incorrect, but maybe send her a message and ask her what she thinks.
Yeah.
But
Yeah.
yeah, I would say don't avoid the work. You do the work, but just try to notice when your negative thought patterns.
I have to focus. I have to push through. Should I do that, or is it like I should try to
No, if you need a break, take a break.
take a break? Yeah.
Yeah, don't ever try to like just be like, oh my God, I'm so gassed, but I'm just gonna keep going, and it's just like, and you just end up hitting a wall. If you're like, okay, I've done this for enough, I just need to have a break, change of scenery, go for a 20-minute walk and come back and see if you're feeling up to it again.
Yeah. Thanks.
Yeah. The best way to think about it is that when you are in a state of higher anxiety and higher symptoms, you are not going to be able to do the things that require neuroplasticity to happen. So if you're fixated on, I want to be more creative, the way to get back to that is to do things that are creative within your threshold. The analogy is the same as if you're trying to improve your balance. If your balance is poor, you have to do more activities that challenge your balance. The same with visual rehab, the same with vestibular rehab. You're just doing more of those things. That's the problem with a lot of these like functional MRI type of tests, is that they give you this information, say, wow, this part of your brain is lagging behind, it's deficient, it's shrunken, but in order for you to do the activities that are required to create the new connections there, you have to be able to have enough symptom control and have low enough symptoms in order for you to do that. Also, physical exercise does that indirectly by just boosting blood flow and mitochondrial function in your whole brain. So indirectly, you can build neuroplasticity that way. So I think that we get focused on, I want one area to get better, but this is what we emphasize in the course, is that if you stick to the pyramid that we've shared and work on all those areas, anxiety and mental health are massively connected to cognitive function. So if you have cognitive issues, work on mental health, because most likely post-concussion, that's the reason that you're feeling not as cognitively sharp.
Yeah.
Yeah.
Thanks.
Okay. Let's move on to...
Hi. Can you hear me all right?
Yep.
Yeah. Okay. My question is just around symptoms and can they change over time? I can give you a little bit of background. I knocked my head about just over a year ago, and I've got a history of sort of concussions through amateur sport and doing dumb things socially. I never took the concussion seriously. So this one, when it happened, I'm now 50, or almost 50. This was quite a profound effect on me. So I've thought I was okay, just sort of waited for it to lift, had a very fixed mindset, just trying on to do what I usually do, exacerbated them, went and got help, exacerbated the symptoms, went and got some help, and then proceeded to exacerbate symptoms again by moving house and shifting boxes and stuff like that, and put myself back in bed, and to quite a serious degree, where I was sleeping 2 to 3 times a day, almost all day, barely getting out of bed, barely going outside. So I put myself on the right track, and thanks to your course, it sort of really helped me understand the direction I need to go. So I've taken on the diet, taken a lot of other things. So I've got an audio vestibular issue as well, and I'm picking up on a neck issue, just in the last couple of weeks. So what happened was I was lying on the floor doing some exercises. I was doing the assessment test. I got off one of yours, one of the modules, and I sort of rolled over to the left as instructed, and just monitoring the dizziness. And then I sort of more of a visual issue, which I haven't picked up on in the past. So going through from the head knock, exacerbating issues, managing them really poorly. Can your symptoms manifestly change over time, or is that something that was always there? I need to go and get rechecked.
No, things change and move all the time, right? Like if you think about it from the fact that persistent concussion symptoms are not due to the initial concussion that you got, they're due to dysfunctions in other areas of your system. So over time, like for example, I'll just use this as an example. If you have chronic stress in your life, let's say, right? Gradually that's dysregulating your autonomic nervous system, but you may not know it yet. But at some point, it's going to start to manifest as symptoms. And then you may start to get hormone dysfunction. And if this continues, you may start to get digestive issues and food sensitivities that were never there. And then you may end up developing an autoimmune condition because after a while of that on your body, all sorts of things start to happen. And so the symptom profile can change and shift depending on what's going on, right? So that stuff can shift. So for example, if there is a vestibular issue, that's there, you feel dizzy. So what happens in your body when you have dizziness is the first thing is that your body tries to stabilize everything because everything's moving around you, right? So your body tries to stabilize, and it does that through activating neck to try and make your neck stiffer so that there's less movement so that you feel less dizzy. This happens subconsciously and automatically. You don't even know that this is happening. But then over time, as your neck gets stiffer and stiffer because of trying to stabilize this, now it starts to impact your visual system. And now you start to maybe get some visual symptoms that are occurring. And so the issue here is that this is when people start to really kind of freak out that things are getting worse. And then that just adds more stress. And then the more stress increases that symptom. Now you start to get sleep difficulties and digestive. So everything compounds and rolls, which is why we, instead of chasing symptoms like most programs do, like most traditional care is like, oh, you have headaches, here's a pill for your headaches, rather than saying, okay, well, why do you have headaches? Let's get at the root cause and actually fix those issues. That's how we approach it. So yes, symptoms can shift and evolve depending on what else is going on. Does that make sense?
Okay, that does make sense. I went to the osteopath about my neck. I think it was yesterday, and she had a real good go at it. And then I've got acupuncture on the neck as well this morning, so I'm really trying to loosen it up. And it has been stiff for quite a while, but I've got a very fixed mindset sometimes, so I just ignore it and push on. So I've just recently just tried to work on it, so that may I think what you said explains it. That the symptoms can evolve. So something I'm going to go to the optometrist next week to get my eyes checked, just as a precaution.
Good.
Then I'll speak to my therapist, audio vestibular therapist, and just let her know that these things have changed.
Yeah, for sure. And they all kind of work together, right? If there's a vestibular issue, your neck is going to tighten up. So if you fix the vestibular issue, the neck will still contribute to the dizziness, and you'll think that it's still a vestibular issue, but actually now it's a neck issue. So that's why it's good that you're kind of looking at all three systems, because you kind of have to work on them simultaneously because they help each other and they also hurt each other if you don't. So you got to kind of peel back the layers, right? As you do more vestibular work and that starts to subside, you work on the neck, that starts to subside. And so they all kind of feed into each other, and it helps kind of in a symbiotic relationship, we'll say.
Right. Thanks for your help.
You're welcome. Next up is
so my question is kind of similar to so basically I'm starting a head coaching job of a summer swim club, and it's going to be like I'm going to be coaching outside from 7 a.m. to 12 p.m. like Monday through Friday, and then I might even do like clinics and private lessons after that for a couple hours. So that starts in the beginning of June, so I have a little bit of time, and this week I started doing, so we have like preseason practices, which is an hour a day inside, and that basically goes until June, and then it's outside like from 7 to 12. So I'm just kind of concerned because it's going to be like many more hours than I'm used to, and it's going to be outside. And I've noticed that things that bug me even more when I'm outside, like things that make my vestibular, I don't know if it's vestibular, I think it is, but like my vision feel weird and I feel kind of dizzy. I feel like it's worse when it's sunny outside, and that's kind of going to be like my life all summer. So I'm thinking of like having a strategic build up to when I'm coaching in about a month. And I was wondering if you have any ideas on what I could do, because I like go on a walk every day for 45 minutes outside, and I'm coaching for an hour every day inside now. But I was wondering if I should just like hang out outside for like multiple hours a day, or do my computer work outside, or I don't know. If you just have any ideas about what to do with that.
Well, I think the good thing about coaching is that you're not just sitting at a desk all day. So there's benefit in that, right? Being able to move and, um, I think being outside is actually really good for a whole bunch of different reasons. Like one is actually getting that sunlight in your eyes and helping that'll help with your sleep big time. Being able to be outside a lot of the time is actually going to help with sleep and some other factors. Getting vitamin D, for example, is always is always beneficial. Um, in terms of the symptoms that you're experiencing, what are kind of the issues? You said dizziness. Are you getting any work done for that?
Well, okay, so I don't really know if dizziness is the right word. That's kind of just the word I started using to describe it. But I get like this weird feeling in my head, like if I'm looking around at things, like it's usually if I'm looking back and forth at things.
Like turning your
Like,
head?
yeah, like an example is like if I go to a car show and I'm looking back and forth at cars on both sides of the road, then I get symptoms. And like if I'm looking for something in my house, I notice that I try not to like turn my head. I just like move my body to look at stuff. If that makes sense.
Yeah.
And I also notice it if I'm like scrolling through music on my phone, stuff like that. Like I feel like my vision's kind of jumpy,
Yeah.
but I don't notice that reading anymore. But I think it's because I've been reading a lot. I don't know.
Yeah.
And I also just get like this. I really don't know how to describe it. It's just this weird feeling in my head that I have either all the time or when I do things like I just described. Um, Also, I notice that like if I go on walks, if I look at the ground, it like makes me feel weird. Like especially if I'm walking on like wood chips or something, and it's like a very, I don't know,
Weird
like
pattern.
yeah, I guess so. It just
Yeah.
feels weird. So
Yeah. To me, this sounds like classic neck, but I mean that's always my
really,
bias. Yeah, it's always my bias though, so it may not be. But whenever I hear these stories, I'm like, oh man, I'd love to just test your neck.
yeah,
Because it sounds like classic kind of neck related dizziness, you know what I mean? Because it's kind of subtle, not really sure how to describe it. Increases when you move your head kind of side to side or look at different things because your neck and your eyes are so connected. And also like just like walk, like one of the tests we do for neck related stuff is I'll have you walk and turn your head all the way to one side and keep walking and see how that makes you feel. And also one of them is looking down and walking, right? And if that, so that's, it's basically just releasing the tissues that are tight or stretched when you're doing a certain position. So for example, if you're doing, if you walk and your head turns to the left and that makes you feel, that sensation of this, like, oh, it feels kind of weird or off, then what we do is we go, okay, what gets stretched when the head is rotated left? And then we release the tension in those muscles and then try it again. And that goes away. And then you've pretty much nailed the issue. Have you done where are you in the program? Like, have you gotten to the vestibular section yet?
no, I'm struggling my way through Melinda's section because I have a lot of anxiety and
Yeah.
stuff.
And that'll contribute, right? So if you do have anxiety, that just increases the tension in your neck, right? If you're worried about the symptoms, like for example, if you have a vestibular issue, let's say, the treatment for that is to make yourself dizzy. That's the treatment. That's how you get better, is actually by doing things that cause the dizziness. But a lot of times, patients, if you're feeling anxious about it, what you do is you say, well, I'm not going to do that, right? Like, I don't want to turn my head. So I'm going to turn my whole body because I don't want to feel dizzy. But by doing that, you're actually hurting yourself. You're making it worse. So what you want to do is you want to do things that provoke that dizziness. So in the vestibular module, we actually have you do things like looking at a target and turning your head side to side like this, right? Because what that'll do is that'll make you dizzy.
I actually do that because I've gone to like 2 different clinics in person before I started this program, and they gave me like a variety of exercises to do, but I never really noticed any like I don't know. I never really noticed that much benefit from doing them, but I also never really did it super consistently, so I'm starting doing some of them again, but I haven't really noticed anything. But
Yeah, and that could be because you have a neck issue.
yeah.
So the thing is, if you have a neck issue and you're doing this, you're not going to get the same kind of benefit because the neck is not getting released. So one thing you may want to add before you go back to work is that if you can find a good like ART practitioner or something near you, if you go to the resources and look in my section, I did a 2-part series on manual therapy and just like what to look for and how to find somebody.
Okay.
You might get some benefit there because that might just give you a little bit of relief of those symptoms for when you do go back to work. But also, yeah, I would continue to work on the mindset piece because like the anxiety of this, even leading up to it, you're already anxious about it. Um, and that'll just make it harder to be able to kind of tolerate, right? So the thing that you have to keep in mind is that even though you feel dizzy, that's not a bad thing. You can
Mm.
still function and you can still do the work. And yes, you feel a little bit dizzy, but you're you know what I mean? But if you start thinking, oh my God, something's wrong, then now that gives you more anxiety and then that makes things, feel worse actually. So it's being able to understand that feeling dizzy is actually a good thing because it's actually challenging your system and that's how you get better. Um, And if it's a neck related issue, getting the treatment on that, you may actually be able to relieve some of that before you go back.
Okay. One thing about that is, so I thought we were supposed to do stuff like that, like rehab and PT and all that, like later in the course. Is it
You
just,
you
yeah,
are.
okay.
You are. Like ideally you are. But and there's a situation where it's like, okay, I have to go back to work in a month and like these are my symptoms. It may just give you a little bit of help before you do that. I mean, a
Okay.
perfect world, you would do everything in order because if you do the rehab too early, let's say your autonomic system is still flared up and you go and get neck treatment, it can flare your system up worse. It can actually exacerbate some of your symptoms and make it worse, and then that kind of sets you back a bit and whatever, right? But when you're kind of up against a bit of a timeline, maybe you try it, and because in some cases it doesn't have that negative consequence. So I mean, ideally we tell people to wait to do things in the right order because that's where you're going to get the most benefit. But in a situation like yours where I have to go back to work in a month, these are my symptoms, it sounds to me like neck is involved. Maybe you're somebody who can get neck treatment, it doesn't flare you up, and that's great. And then okay, we've helped you to be able to do the work you need to do.
Yeah. Okay, cool.
Yeah. So I would look first at the neck because um that's the one. I would keep doing the program and keep working on the mindset, keep trying to do things to reduce the anxiety around the symptoms, keep telling yourself that it's safe, that it's okay. Symptoms are not a reflection of something bad or that you're making anything worse necessarily. Um, it's just a symptom, and you can still deal with it, and then see if you can get some good neck work in the meantime and see if it helps.
Okay, thanks.
Yeah, you're welcome. Okay, last one would be
Hey, I've been working with you guys for quite some time, like 3 years. and we've been working pretty hard on trying to figure this out. And we're kind of determined it's the neck area. Listening to, I've been through it, going back through it, did visual therapy. I've done it all. I've seen all the doctors, and we kind of determined it's in my neck. I fell in the last 2 weeks. I fell again, but I didn't hit my head, but I fell on my shoulder, my left shoulder, and extreme pain, still in extreme pain on my left shoulder going into my neck. Went into the practitioner, and again, they saw my neck is extreme, severe. It's a mess, is what they say, and we've known that for 3 years. 1 minute they want to do surgery, the next minute they don't want to do surgery, that it's not going to help my symptoms when it comes to concussion. My major, and now I fell again, and it, like, everything came back, the sensitivity to light, the walking, the balancing. I was up to an hour and a half of walking, still very, very dizzy, but like you said, turning my head, I've done it all, and kind of hit a plateau and figured, well, I can manage this. I just started hitting golf balls. So I had come to a point where I was still, on a 10 scale of falling down, I probably got myself to a 5, was able to hit balls, but still it was very difficult, can only do it for an hour, where I was used to hitting for 4 hours. So now I'm going into the doctor on Monday, to a surgeon, and there's a disagreement, is it the neck? If I do surgery on your neck, you're still going to be, it doesn't necessarily mean it's going to fix your balance. It isn't going to fix your nauseousness. It's not going to fix what you need. And then my eyes, the reason I fell is because I can't see below I keep running into stuff, and they've gotten really bad. And I did the vestibular for 3 months during this whole process, and they told me everything was good except for to get that string to do short vision. Anyway, my eyes, you can see when you look at my eyes that the one is going in, and then the vision doctor said, you got one looking outward, one looking inward, but I think I'm looking at you. So I don't know where to go from here. I'm going to the surgeon. Do you feel, you keep talking about neck? When the neck always comes up, then we know it's my neck, so if my neck is unstable, I have severe degenerative discs. So if my neck, and then this last fall, the guy I just went to said that my neck is out of line. So what's your thought on surgery? Is that the answer? If I've been through all this, and I fell again, that probably knocked my neck out of line, but I hit my shoulder, which went straight into my neck. So now that right side popped out. So but with x-rays, no broken bones, nothing, waiting for an MRI to get in to do another MRI. But the last MRI, I was in urgent care, and they said, I don't know. I'm at my wit's end here.
Yeah, we've been talking.
Yep.
So
yes,
it's tough to say like what is going on, because the pictures you sent me, like I can see that you have, that one eye is turning inward. And then with the extreme kind of balance impairment, I would want to be ruling out things like, is there some sort of cranial nerve palsy? Is there some sort of stroke or like tumor or something that's causing those visual symptoms to increase? Like that's the thing that I'm concerned about, is something, and this is unrelated to concussion or neck or anything like that, but your neck does influence vision, but it's a lot more subtle than that. Like you're not going to get this inturning of the eye, right? To me, that points that there's some sort of cranial nerve palsy, and it's pulling something, and something is not doing its job to keep that eye out, right? Whether that's the muscles that control that eye movement, or it's the nerve, right? There's a nerve that goes, it's cranial nerve 4 that goes to that part of the eye, and if that's not doing its job, the eye will start to turn in because the muscles on the inside are overpowering the muscles on the outside, right? That eye starts to turn in. Now the question is, why is that? Was there some sort of stroke in that area? Is there a tumor developing in that area that's putting pressure on that's cutting off that nerve supply, right? So these are the things.
I think I told you, I have they say it's not a tumor, but I do have a thing in the middle of my brain that we keep watching every 6 months to see if it's going to grow. And they say it's not. We started that 2 years ago when we found that. But they say it's not a tumor. They say it's what do you call it? A cyst.
Yeah.
And they say it's in a really bad place in my brain. So doing surgery is something you really don't want to do, because I could end up a complete mess. So maybe, and then I hit back my optical nerve. The eye doctor I went to, who has worked with concussions, said when I landed, he said, if you would have hit your head any other place but that back left lobe optical, he said, you hit your optical nerve. He said, that is why my eyes are, one's going one way, one's going the other. But
maybe I don't agree with that. You can hit the occipital lobe and you can have visual type symptoms, but that's not going to make your eye turn in. That's a cranial nerve, which means that's brainstem, which is in a different area. So I don't agree with that.
And that's who I'm going to. He's a brain surgeon, #1 brain surgeon in the world, Dr. Randall Porter. I'm seeing him on Monday. What questions?
So he's going to look at your eyes. He's going to do some tracking to see, are they locked in, and he's going to know exactly where to look. Okay? So that's good. That's good. You'll get that on Monday. Now that's more kind of brain related because it's cranial nerve related. Now, if your neck is a mess, which it sounds like it is, and they're considering doing surgery and all that other stuff, right? Usually they're going to do surgery to try and stabilize something. And usually that results in some sort of fusion where they'll just fuse vertebrae together, right? Now, sometimes that can make balance and other issues worse because those muscles around will tighten up. They'll react to that. You'll get scar tissue in there and all that other stuff. And so a lot of times it can make it worse. And then there's really kind of no treatment that will help. It's just that those vertebrae are fused now, and that's just it, right?
Yeah, that's what I'm afraid of. That's why I refused the first time, and then I went back in and, okay, well, now it isn't going to work. But so that's my fear. So I want to know your opinion of what to ask him, because that, like you said, if you keep your neck straight all the time, but my only relief, I'm back to if I just lay down. If I lay down, everything goes away. Not the pain in my neck.
Yeah, I mean, I think that I'm gonna beat this to death, but I think that your best bet, hands down, was doing topspin. Because even people with severe degenerative, discs and necks, it actually strengthens that in a functional way. It's the best thing I've ever seen, and we've seen it done on people that have all sorts of crazy neck issues. Now, what I would ask the surgeon is, because they're the ones that basically told you not to do this.
Right. He said no, and that's what
and that's there's no risk because you control it. So it's not like it can do anything harmful, because you're the one moving the device. And so you're only able to work within your own ability. And so and then you gradually increase the strength, and then you can do more and more. And what it's doing is actually stabilizing your neck, which is kind of what you need, but without fusing it together. So that's why I still keep coming back to this, saying like, I think it was a major mistake to not do that. But they're the ones that said no. So
Right, because they said if you're at the brittle stage, and if you spin, you do this for how long, how many years, how many months, whatever, that you're so unstable and so brittle. That's what. And again, I'll ask them on Monday, because it wasn't the doctor, it was the assistant, just giving me the notes from him, blah blah blah. But I just scared the bejesus out of me that, oh well, if I do this, then I'll be paralyzed the rest of my life. I was just,
Yeah,
I can't.
But that's the thing, like, Theo, he would have looked at all of this stuff and thought that you were a good candidate. He wouldn't recommend it if he didn't think you were a good candidate, or if there would be safety risks. He's not going to
But
take
he
that.
didn't see my X-rays or MRIs or anything.
Oh,
So
well, I would think
yeah,
before they would start a program, he would want to know all that. But anyway, just going back
Okay.
to this idea
Okay.
is that if your neck is unstable, what you want to do is try and stabilize it. And that's exactly what this tool does, but it does it in such a gradual, safe way that allows you to build the strength over time. It's not like it makes it worse. It makes it better, and it makes it better quite rapidly. And I think if you have a lot of this neck-related dizziness and neck-related symptoms, this was hands down the best bet that could have been tried prior to going the surgical route. Now, this doctor said no. Okay, fine. Now my question to him would be, now, okay, you didn't want me to do this, so what's your solution? What's your solution then? Right?
Yeah, correct.
And that's it. That's the only thing, right? It's like,
Okay.
I can't really advise any more other than that, because there's all sorts of other complications going on. We can't be your doctors. Like, I can't look at your reports or anything like that. We're not allowed to do that. We're allowed to provide kind of general guidance and advice, but it's basically, now you're in the hands of the surgeon. My recommendation was to at least take a look at topspin, and you did that. And now it's like, okay, well, I would lean on the surgeon to figure out what your best bet is, because
But if that surgeon doesn't believe that stiffening my neck, if he see, that's where I have you're sold on fusion and whatever is going to make it worse, which I agree with you. Probably
I don't know that it'll make it worse. I've just seen this happen in patients where they have a prior fusion, and they have these types of symptoms, but because it's now rigid, you can't loosen it. And so they end up with situations where it's really, really difficult to get relief. I'm not saying that's what's going to happen to you. I'm just saying that is a risk of doing something like that. But you're going to have to really talk to the surgeon, get second opinions. Like, you're just going to have to do a lot of digging to figure out what the best course of action is. Like again, just to beat a dead horse here, like, I would think that the best bet would have been to do something like topspin prior to. Like, that would have been like, okay, we'll try this. If that doesn't work, then we can look at doing the next, kind of extreme step, which would be surgery. But he stopped that before it even happened. So, okay, what's your recommendation, surgeon? Where are you at?
right. But I wanted to see if there was anything I could bring, or any questions I could ask him, where your concerns are, as far as, because it's you've studied the neck issues, saying that can cause all the symptoms that I'm having, but yet they disagree with that, is what I'm, so yeah, well.
My area of expertise is generally on neck dysfunction causing concussion-like symptoms, and all of the symptoms you describe can be neck related. And so
Okay.
they can disagree with that all they like. The fact of the matter is that it's true. So
Right.
these guys are orthopedic surgeons. They're there to stabilize joints, right? They're neurosurgeons. They're there to make sure that the tumors are under control and whatever. But these like subtle kind of neck function and how that controls eye movement and stuff, they don't know with any of that stuff. So they just assume that, well, I've never learned that, so it's not true. It's not the case. There's tons of evidence to show this, but usually it's in physiotherapy journals. Well, they don't read physiotherapy journals, so they're going to not understand it. And so that's fine. They can disagree all they like, but the evidence is there.
So what you're saying then, I'm probably just out of luck then, because if I don't want to do surgery and I can't do top spin, I just doing the normal working with my
I just think it'll take a long time. I think if I haven't assessed you, so I don't know what's going on. If you need to stabilize, then you need to do stabilization rehab. Traditional stabilization rehab is done with things like TheraBands and trying to do stuff like that.
Done all that.
The head-to-head research shows that this TheraBands and whatever else you get marginal improvement, top spin, major improvements. So that's why top spin would have been the best bet to do. So you've opted not to proceed with that based on the advice of the surgeon. So now I think your next step is you go to the surgeon, you say, okay, I'm having this eye issue. They'll do an assessment. They'll figure out kind of what's going on there. If they need to do more imaging or whatever, how quickly they need to do it. They'll rush it if they need. And also your only real other question is like, okay, what are my options here? Because you told me not to do this. So then what can I do? What should I do? What should be the progression?
Yeah, should and progression. Okay. All right. That sounds good.
Yeah, it's tough because there's a lot of cooks in your kitchen here that are.
There's way too many cooks for way too long.
I know. Oh man, I wish they would have been okay with the top spin, because I think that would have been a key ticket for you, like a really key ticket.
Yeah, well, time will tell, but I appreciate it, and I'll be in touch after I talk to him on Monday.
Okay. Good luck.
Okay. Thank you.
Thanks everyone for coming. Hope everyone has a fantastic Thursday. Bye.
Thanks for joining us. See ya.
Thanks, guys. Bye. Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.